Hello, I'm Dr. John Montanaro, Director of Expressive Arts Therapy, Assistant Professor for the Icahn School of Medicine, Brookdale Department of Geriatrics and Palliative Medicine here at Mount Sinai Hospital. I'm going to talk with you today about the hybridization of expressive arts therapies with child life in the support of patients and families. I'm going to take you through a few slides here. I have no disclosures, no conflicts of interest. And the learning objectives that I will impart to you today is that you'll have an understanding of the function of expressive arts therapies in palliative care. You're going to be able to describe three attributes shared by music, art, dance, movement, and drama therapy, and demonstrate a working knowledge of accurate terminology when describing expressive arts therapies. And the key words to be listening for throughout this presentation are identity, relational, coping, aesthetics, and psychoeducation. So if we look at expressive arts therapies, it's a profession that includes music, art, drama, dance, movement, and poetry or bibliotherapies as relational and therapeutic offerings within a therapy relationship forged with patients and families according to their individual needs. And the way that child life support folds into this framework it's an easy fold in because it's relational work as well, supporting adult patients navigating illness through palliative care and the needs of their children and other family members. So the two work hand in hand, and I'm going to be showing you that in the coming slides. Let's starting with a philosophical framework for expressive arts therapy. What transcends the creative arts therapies when we talk about expressive arts therapies is the ability to move into human imagination, to believe that everyone has the ability to move into a world of imagination and aesthetic responses to their world, and to create meaningful changes in the way they see their world. Expressive arts therapies are not grounded in any one particular technique or media, but in the capacity of all of the arts to respond to human suffering. The therapist's presence, creative and aesthetic sensitivity, and empathy are used to support patients' capacity to create aesthetic order and meaning. And sometimes that is profound within the hospital environment and the navigation of illness in the environment of the hospital, which is often lacking in any kind of aesthetic stimulation. As therapists, we have the responsibility to give insight to help frame our patients' experiences with illness by use of our own sensitivity and creative vision, to help patients find beauty where beauty may not seem to exist for them. And this is all drawn upon the pioneering work of Stephen Levine, who did much in the beginning of expressive arts therapies and establishing it as a profession. We also want to talk a little bit about care aesthetics, which is the new area of interest it's developing, mostly by Thompson in his recent book, Care Aesthetics for Artful Care and Careful Art. And this philosophy of care is really looking at all care delivery as a form of art. If we think about creating and aesthetically framing human experience, that we value and support aesthetically caring relationships across multiple aspects of our lives. Artful care and caring art are interchangeable. And it's practiced by all professions, not just expressive arts therapists, but doctors, nurses, social workers, chaplains, looking at the human experience through a frame of beauty. Social and community arts engagement is a perfect way to reference this work in the communities that we live in. Expressive arts therapies are delivered by therapists who are licensed mental health professionals. Art therapy specifically uses the art materials, tangible materials of clay, paint, canvas, brushes, to help explore inner process and projecting onto an outward screen. Dance movement therapy looks at the self and how we embody space and time, and dance movement works with the patient individually and in group to feel themselves in real time and real space. Drama therapy, the intentional use of what we call theater processes, role play, embodied practice, active, experiential. It provides a context for people to move inside their story and enliven story and their narrative of what's happening in their lives. And music therapy, which is what we'll spend most of our time on today, because it traverses levels of consciousness and diagnosis and age and culture. It's a clinical and evidence-based use of music interventions to accomplish individualized goals within the relationship with a therapist who's credentialed and professional. Music therapy interventions address a variety of healthcare goals to promote wellness, manage stress, alleviate pain, express feelings, enhance memory, and improve communication and promote physical rehabilitation. All of these aspects of the self are capable of being reached within a music therapy session. It's important to note the training and credentialing of expressive arts therapists. Most are graduate or doctorate level trained, and they're credentialed by national governing organizations for each profession. MTBC is the Board Certification in Music Therapy. RDT is registration as a drama therapist. ATR, Art Therapy Registered, and Dance Movement Therapy, Dance Movement Certified. And licensure in New York State is a New York specific credential, licensing the expressive arts therapies as creative arts therapies in mental health. And then many therapists, including myself, specialize in trainings, certification such as child life, trauma-informed therapy, family-centered therapy, and culturally focused care. These are just a few of the areas of specialization that expressive arts therapists might pursue. In palliative care, we can look at bullets of what the work is comprised of. We empower the narratives of the people we meet, exploring personal values and goals and aspirations, affirming identity beyond that of patient, but of who the person is in the world. We provide aesthetic framing and referencing outside of the context of illness, and inclusive of that as well. Cultural and familial support, symptom and coping support, inducing flow and engagement in the environment and the external world to promote psychological health, healing, and growth. And to transform the perceptions to facilitate self-exploration, discovery, and awareness. That one is not simply a patient navigating hospital care, but a mother, a father, an uncle, an aunt, an architect, a lawyer, a gardener, a homemaker, navigating illness as one aspect of their life. We have to talk about product versus process, because when we create something that's tangible. It could be a piece of artwork, it could be a dance piece or a song. And that product in and of itself stands as a representation of the work spent in therapy. But it's the process that's quite rich. It's the getting to the product that contains some of the richest exchanges, some of the identity affirming opportunities to express oneself in moving toward the creation of a final piece. The final piece may never be reached, but the process in and of itself is quite rich. So product versus process is part of the dialogue when we speak about expressive arts therapies. I'd like to break down each modality a little bit for you so you can see what the literature is saying here. In art therapy, art interventions create sustained decrease in agitation, enhance social contact, provide a context for altruism, helping each other, wanting to support each other, emotional and creative expression. And the most recent meta-analysis, a 2018 Cochrane review, asks for more research, and that is the charge of all the expressive arts therapies, is to substantiate the work that we know anecdotally and as evidence-based, substantiating it through arts-based research, mixed methods research, and that work is upon us. Dance movement therapy, again, the literature shows that embodied work can be effective for people living with complex needs, people who are alienated from their bodies because of illness. feeling oneself in time and space. One promising study looks at the effects of movement on dementia progression and cortisol levels from mood state. And again, a Cochrane review of 2023 asks for more research. So again, the charge to substantiate the work through arts-based research, mixed methods research that can measure what is measurable and talk qualitatively about the rest. This is the charge of dance movement therapy as well. I'd like to show you a snippet of movement. This is a group conducted by a music therapist, a group of palliative care patients who are diagnosed with Parkinson's and dementia, and they're moving through a piece of music, feeling themselves in time and space. We look at drama therapy as well. Positive forms of engagement are increased, while negative forms of engagement are decreased. Depression is decreased during engagement, and quality of life is higher during engagement. Increased altruism through the sharing of life story. This is the literature in drama therapy, most recent literature findings, that it's putting forth real goals that can be achieved with people navigating illness. When we look at music therapy, as I said earlier, music of all the modalities has the potential to traverse levels of consciousness, age, culture, and family system. And so we use music therapy frequently in palliative care. I'm going to talk more about that in the coming slides. It all starts with a therapeutic relationship, and this goes for all the modalities, that we establish rapport and trust in order to invite and engage individuals in a therapeutic process. In music therapy, that trust begins with the use of patient-preferred music, meaning the therapist does not come into the room and starts playing music of their choice, but rather we assess and inquire and learn what music is most meaningful for the individual and family that we're working with. We can use music for relaxation, and we can use music within an improvised structure that moves beyond expectation and structure of what a song is and has been, and move it into what a song can be for that patient in real time. Music has the potential to invite nonverbal expression of feelings as well. Some of the goals in music therapy is socialization, mood enhancement, expression of feelings, well-being, engagement in altruistic experiences. Music therapy interventions to achieve those goals can be anywhere from improvisation to recreative music therapy, that is taking the songs that someone loves or knows from different aspects of their life and recreating them in real time with real instruments in perhaps a way that is unique to that person in that moment. We can create soundscape and sound bath. This is the use of improvised music to create a sonic space that's aesthetic and comforting without referencing into one way of thinking or a particular song. Songwriting moves expression of poetry and thought and narrative into the structure of a song form. Free associative singing and vocal holding is the use of the voice to invite another level of being. Free associative singing may be connecting what is happening in real time over a series of chord changes to give harmonic and aesthetic sense to the thoughts that need to be expressed in that moment. Entrainment utilizes the physics concept of entrainment, matching emotional and physical presentation with sound and harmony and melody, and then with the idea of morphing that presentation toward a desired goal. And tension release Another example of using entrainment, but to access the tension that occurs in music and mirroring that and matching it to the presentation of the individual in front of you in order to create and mirror and entrain a natural release of tension and therefore relaxation. I would like to give you an example of that right now. On guitar, we start with the harmonic space. Introducing tension, resolving to the harmony, escalating to the tension, resolving, and tension, resolution, and back around the cycle again. Harmony and relaxation, the tension that naturally occurs with pain or uncertainty, the resolution, the tension, resolution, tension, and resolution again. And this cycle of tension release chording is used with pain, emotional stress, to entrain and to move the individual into a space of more relaxation, of meditation. That's an example of what can be achieved with a harmonic instrument like a guitar or a piano. And then we have non-harmonic instruments as well. The sound of an ocean disc. To emulate the gentle pace of nature. The relaxation of hearing a wave come in on the beach. Its movement through its continuation, through its completion. And the onset of a new wave that resolves. Waves cascading against the seashore happen in rhythm. And just like our bodies move in rhythm, our heart beats in rhythm, we breathe in rhythm. Nature sounds such as the ocean disc can entrain in a less structured way to bring us to a place of relaxation. We can add chant or free associative singing. Another day, just believe another day. Just breathe another day. Just believe another day. Just breathe another day. Just believe another day. Just breathe. So we create mantra. Patterns that contain emotion in a frame that's predictable. It can lend safety and structure to an environment that is fraught with uncertainty, fear, and anxiety. Removing those emotional elements naturally through recreation of a song that's well known into mantra form can also be effective. Fly like an eagle to the sea. Fly like an eagle, let my spirit carry me. I wanna fly like an eagle to the sea. Oh, there's a solution. Many possibilities. When we talk about folding child life support into the expressive arts therapies that I've just described, it's a natural marriage. We meet patients who are navigating their illness and treatment, and perhaps they have children, 2, 3, 4, 5-year-old, 12, 13, 16, 17-year-old. The age is irrelevant. The child is in relationship with a parent or loved one, significant adult, who is navigating serious illness. And explaining and helping that child to make sense of what's happening is part of this work. It's relational work. It's built into the psychotherapeutic relationship that's been forged with the patient. Through this support, the family system is accessed. Authentic information sharing is modeled. The concept of inclusion is bolstered, including children in conversations. And we do this through psychoeducation, education that is accurate, using accurate terminology, but delivered in a psychotherapeutic manner. Supportive sessions can occur pre or post the sharing of information at a psychoeducational level. Family-centered expressive arts therapy sessions are commonly practiced with art, dance, movement, music, drama, even poetry writing. Living journals, books that are left at the bedside with family members to document the visitors who come in, documenting prayers and mantras and thoughts for their loved one. Creation of transitional objects using artwork or cards or decorating a pillowcase, things with metaphoric meaning, a song creation, a life celebration box, a box that's decorated and contains meaningful objects or gemstones or objects from nature or mementos from the patient's life can be added to these boxes. Supporting inclusion through authentic and accurate and developmentally targeted psychoeducation is the key. And doing this through narratives is the main pillar of the work that we can do with children trying to understand and coming to terms with their parent or loved one's illness. The use of story, a book, is utilized because it's familiar. From the time we are first able to hold a book, the age of 2, even before, to look at pictures, to pass through pages, this becomes a familiar and non-threatening form that is effectively accessed for this work. Making it personalized, individualized to the children's interests. Maybe one child loves soccer and one child loves to play with dolls, and making cookies with their loved one is something that they share in common. Including this type of biographical information makes the book personal, and it becomes an object the child can hold on to. It presents groundbreaking at a basic level of facts about the body and how illness affects the body. The heart pumps blood, the lungs help us breathe, the brain manages many different tasks that allow us to do what we do. and then to lay in the understanding of why an illness is affecting a certain organ at a certain time in a certain way allows the child to understand cause and effect, to create patterns to better construct a story that they can understand about loss and uncertainty and what illness is infringing upon their loved one's life and their own. The benchmarks developmentally are that no blame, nothing said or done, can make someone sick. We all get sick, but we usually get better. We don't all get sick in the same way. And this validates feelings and allays fears that because grandma or grandpa has this, I'm going to get this. Anticipatory grief and processing death in congruence with the family's beliefs is also part of this. Using accurate language, no euphemisms, not so-and-so went on a long journey or so-and-so went to sleep forever. Those are scary thoughts for children. We all go to sleep and we wake up. We all take vacations and go on trips and we come back. So avoiding euphemisms and going instead utilizing accurate language to describe life processes is part of the work that we do. I want to show you a video of work that engenders all of the concepts I've talked about. We have a Chinese man, Cantonese speaking, a wife with 2 sons, 5 and 8 years old, and a nephew who's 15. This gentleman had end-stage lung cancer, no curative treatments, 3 music therapy sessions focused on comfort and aesthetic experience, allowing him to experience himself in time and space through movement, inviting the children to visit and engage in something non-medical, allowing the mom to feel supported by having her children supported, and allowing the patient to show his children, his family, another part of himself beyond being the patient. This patient is doing beautiful Qigong, a motion that's familiar and part of his healthy life. And he's doing that in the hospital bed. So we'll watch this video and we'll talk a little bit about it when we finish. If we think about that case, we see children participating in something of meaning and value, rather than just coming into the hospital with nothing to do, but to be able to help their father with pain management, to be able to participate in music therapy on that level. Art therapy was provided at the end of that session. When the children moved beyond music, they were invited to engage in art expression. Posters and cards that adorned the walls of their father the following day. Moving from that work into a general summary of language that is important to clarify here. Language is everything when we talk about meeting people and introducing services and in seeing people for who they are. We use words refocusing rather than distraction. Distraction means to take power away from someone, to think that we can distract them from their experience, whereas refocusing invites them into a conscious movement away from distressing thoughts by their own choice and volition, not ours trying to trick them. Integrative versus complementary versus alternative. These terms have come into in and out of vogue over the past 40 years. Alternative being the earliest form in the 80s to describe therapies that were beyond medical treatment. Complementary, integrated, but not quite fully understood, to integrative therapies in this millennium, looking at music, art, dance, movement, drama therapies that work coincide with medical treatment. Engagement rather than entertainment. People can engage and experience a different level of agency when they're engaged in processes rather than being entertained. Intentionality versus ambivalence. What does it mean to be specific and intentional in your actions as opposed to just having things done to you? Relational versus paternalistic, meaning we keep choice as an active part of the exchange of the therapeutic relationship. It's not governed by power dynamics. Therapeutic relationship versus alliance. What does it mean to be in a relationship in therapy and then to align for a specific goal, perhaps a blood draw, perhaps getting through procedural support of other kinds. And therapy versus counseling. We invite people into problem solving on their own. We don't tell people what to do or advise them on how to be. But in therapy, we invite into a process of conversation and meaningful reflection. Let's move to some questions. Question 1, expressive arts therapies in palliative care are specifically designated for A, individuals with deficits in receptive and expressive speech, B, professional artists, musicians, dancers, and actors who are hospitalized with terminal illness, C, any individual navigating the challenges of illness and hospitalization, D, only children because adults should not waste their time with the arts. And the answer is C, any individual navigating the challenges of illness and hospitalization. Therapists receive a range of referrals that are triaged and assessed for need, including child life support. Expressive arts therapy is grounded not in particular techniques or media, but in the capacity of the arts to respond to human suffering. Question 2, child life support in palliative care is being utilized as an intervention to A, babysit children when their parents come to the hospital to visit a loved one, B, support patients and families worried about the children in their lives by assisting with the creation of developmentally targeted psychoeducational booklets and supporting opportunities for meaningful engagement when visiting, C, keep children quiet during family meetings, D, help parents hide the truth from children to avoid scaring them. And the answer is B, support patients and families worried about the children in their lives by assisting with the creation of developmentally targeted psychoeducational booklets and supporting opportunities for meaningful engagement when visiting. A take-home point, expressive arts therapies are individualized and relational forms of psychotherapy offered by licensed and credentialed therapists to patients and families according to individual needs. Again, supported by the Stephen Levine's philosophy of expressive arts therapy. Selected references. And for additional information, feel free to contact me, john.montanaro@mssm.edu, or 212-241-3783. Thank you.